I ask a question? Are
Yeah,
we
yeah,
live?
definitely.
No. No.
No,
Just,
now it's not live,
just I
sir.
have to.
We are live. We are live.
Oh, okay. Great. Then I think let us go to the. You come. Please help me in making this presentation. Please share the screen of that presentation.
Okay. So good morning, good evening, everyone. So on behalf of Cardiac Division from Malamik, I warmly welcome each participant to today's Volume Matters webinar. So today's topic is lifestyle tips in hypertension management. So now I pleased to introduce our speaker, Dr. Omnath sir. And sir will guide us on simple and practical lifestyle measures for better BP control. Thank you, sir, for joining with us. So over to you, sir. Sir.
So let me go to slide number 1. I think we are on slide number 6. So let us go to slide number. And I think I'll go full screen mode. Am I audible?
Yeah, audible, sir.
Yeah. Okay. So let me. So good evening, all. On this eve of World Hypertension Day, so we are celebrating World Hypertension Day on the 17th May of 2026. That is coming Saturday. So today we will be discussing. What did you say? The videos. Okay. Start my video. Start my video. First one. I think now it is clear. Okay. And where is the 1 minute sharing? Okay. Are my slides visible now?
Yes, slides are visible now, sir.
And okay. So the topic for today is regarding understanding and controlling blood pressure for a healthy choices for today as well as tomorrow. So we all know that hypertension, or what we call as high blood pressure. So basically it is because of a retention of salt and water in the body. So when we consume excess salt, that increases the body fluid volume, putting extra strain on the heart and blood vessels, leading on to high blood pressure. So excess salt intake leading on to fluid retention, leading on to increased blood volume and increased workload on the heart, as well as increased tension in the vessel walls, leading on to high blood pressure. So controlling the salt intake and body fluid volume is the key to protecting your heart and managing blood pressure. So we all know the target for blood pressure control. When we are treating a patient with hypertension, the targets recommended are different in various subsets of population. So somebody who do not have any comorbidities, the ideal target is less than 130 by 80 millimeters of mercury. Whereas if somebody has a prolonged diabetes, or somebody has a chronic kidney disease or cardiovascular disease, the recommended targets are 120 to 129, and for diastole it is 70 to 79. So achieving the right blood pressure target helps to protect the organs and reduces the risk of heart disease and complications. And you have to consult your doctor to achieve and maintain your blood pressure targets. Regarding the diet, so the worldwide the studies have shown that the best diet to control hypertension is what you call as the DASH diet. DASH diet is a acronym for dietary approaches to stop hypertension. So the DASH diet is rich in nutrients and can help lower blood pressure and support heart health. So basically, it encourages the intake of more vegetables, fruits, and meat, etc., which are low in calories, and it recommends to cut down on free sugars and unhealthy fatty foods. So eat more of fruits and vegetables and all grains. That will help to provide essential vitamins, minerals, and fibers. And you have to choose low-fat dairy and nuts, fish, and poultry. So basically, those who are good in polyunsaturated fatty acids, and the process of and healthy fats. And you have to strictly cut down on the red meat, sweets, and sugary drinks. And this helps to reduce the calories, sugar, and unhealthy fats. You have to ensure that you are getting enough fruits and vegetables in your diet to ensure that you are getting good amount of potassium, magnesium, calcium, and fiber. This will help to support the healthy blood pressure and overall health. Adopting the DASH diet every day is a simple and effective way to manage blood pressure and protect your heart. And most important is to reduce the salt intake. This is going to protect your heart. So even a modest reduction in salt intake can significantly lower the risk of heart disease, especially in people with high or difficult to control blood pressure. Indian diet is very rich in salt, so you have to reduce the salt added to the food item while cooking. So you have to limit the salt intake to 5 gram per day, and you have to avoid processed and fast foods like bread, burgers, and all those things are very rich, very high, having a very high content of salt. So you have to avoid those things. And instead of using a sodium based salt, you can use a potassium chloride. It's an alternative, salt alternative. It will help to reduce the blood pressure, and less the salt today, a healthier heart tomorrow. And another important thing is maintaining good physical activity. So you have to stay active every day. A regular physical activity helps to lower blood pressure and improve overall heart health. So when we say exercise, it is better to do aerobic exercises like brisk walking, jogging, cycling, etc. That will help to reduce the blood pressure more. And at least 30 minutes most days. The recommendation is at least 150 minutes of physical activity per week, and in addition to that, you have to have a 30 minutes of weight training also per week. That is the best exercise prescription for hypertension as well as cardiovascular disease management. And from 30 minutes you have to as much as possible you can do, ideally 60 minutes if you walk, that is much better. Or per week 300 minutes of physical activity, that is more helpful. So move more, sit less, for a healthier heart and lower blood pressure. Again, stress is a very important risk factor in the current generation, current era, because of our lifestyle and our job, all those things. So stay calm, stay healthy. Managing stress through meditation techniques like yoga, deep breathing, and other meditation techniques can help lower blood pressure and improve overall well-being. So yoga reduces stress and support blood pressure control. And again, deep breathing exercises again relaxes the body and mind as well as lower the stress. And again, another other forms of meditation also help to give calmness and focus. So stay calm, manage stress, and take control of your blood pressure. Again, now for most diseases we know gut is the center of health. So a good gut health reduces the blood pressure. So we have to maintain a healthy gut flora. So a healthy gut flora can reduce the inflammation and reduce blood pressure. So a healthy gut, a healthier heart, and lower blood pressure. So to maintain a good healthy gut flora, you have to eat more fiber from fruits and vegetables and whole grains. And you have to include items like yogurts and probiotics, which can produce this, which can supply this healthy bacteria to the guts. Probiotics are good bacteria that support gut health. And you can add prebiotic and probiotic rich foods. And then you have to cut down processed foods, excess salt, and saturated fatty acids like bread, burger, cheese, pizza, etc. So take care of your gut, and it will help to take control of your blood pressure. And building healthy habits. So we all know we have to strictly avoid smoking. Even passive smoking is injurious to health. So smoking is a strict no. So avoid smoking and energy drinks. So that we have to reduce the calories. So most of these energy drinks like what you did, Pepsi, Coca-Cola, all those things are very high in sugar, in calories, and we can produce all sorts of lifestyle diseases. And coming to alcohol, again, you have to hypertension patient ideally have to stop taking alcohol. It will help in a as limited heart. When it comes to medication, it's very important to adhere to the medication strictly and follow lifestyle changes along with the prescribed medicines for better blood pressure control. Adopt healthy habits today for a healthier heart tomorrow. I think that concludes our short discussion. Thank you all for patiently listening, and I'll be happy to answer some questions if there are any.
So thank you, sir. Thank you for informative section, sir.
the close one of the session.
So we will now begin the question and answer section. Sir, actually, few participants there asked few of the questions, sir.
You
So
can read out the question. I will try to answer.
Okay. Okay. One participant that asks, Doctor, how will I know if I have high BP?
See, blood pressure can be diagnosed only by using of a clinical measurement. So, if you have some symptoms suggestive of blood pressure like headache or exertional breathlessness, or you have some other risk factors like diabetes, or you want to check yourself to see whether you have blood pressure, you have to consult a doctor or a physician assistant or somebody who can measure the blood pressure accurately using a sphygmomanometer. So nowadays we don't recommend using sphygmomanometer. Even these digital apparatus are also good enough. So you have to measure your blood pressure with either of these things.
Thank you, sir. And sir, one other question is, can I eat pickle if I have blood pressure?
No. See, that's it's not like, see, pickle. They're all very rich in salt. Like apple, pickle, all these things are very rich in very high. They have very high content of salt. So to reduce the salt intake, ideally you have to avoid these items. But even if you take a very small little bit, so that you maintain a balance. Okay.
Okay, sir. And sir, one other question is that, sir, can I stop BP medicines once my BP becomes normal?
See, that is a very tricky thing. Like, suppose that differs from patient to patient. Say, like somebody who is like a 30-year-old man who is obese or overweight, and he has a blood pressure. With the proper lifestyle and diet, along with medications, if he's able to bring his blood pressure under control, many a times we will be able to stop the medication, because the weight itself will contribute to blood pressure. The lifestyle also will contribute to the blood pressure. So if you are able to manage with the diet and exercise and diet in some young individuals, but as when it comes to all people, and don't know, it may not be work that way, and they may have to take a small dose of medications. But of course, you can titrate. So if you have got a high blood pressure, say like 160 by 100, and you are put on 3 medications, and once it comes to the target of 130 by 80, you can, and he's maintaining that, you can always try reducing the dosages. Regarding stopping the medications, as I mentioned previously, somebody who has reduced a lot of weight and is able to maintain a good healthy lifestyle, and somebody is young, so in those cases we may try stopping the medication. But an elderly patient or somebody has comorbidities like diabetes, heart disease, etc., we never stop the drug.
Okay, sir. Thanks. And sir, one more other question, sir. Is tea and coffee okay to be taken?
See, regarding tea and coffee, both will increase the heart rate as well as blood pressure. If you have a hypertensive patient on medication and all, better to restrict the number of tea and coffee. It is not like they cannot be taken. You can have like one morning and evening 1 cup of coffee you can have. If you are otherwise healthy individual, suppose you are a very healthy individual without any diseases and all, studies have shown that pure coffee, like not without any added sugar and milk and all, if you take pure coffee, it can have some health benefits. But when it comes to hypertension and management, you have to restrict the intake of tea and coffee. Definitely.
Okay. And sir, few participants they are asking, what is the correct way and best time to check BP at home?
See, there is no timing. Rather than the timing, the correct way is important. Okay, so first thing is that you have to take rest for 15 days. So if you just do some activity and come and take the blood pressure, it is definitely going to be high. So you have to sit at one place quietly for at least 10 minutes, 10 to 15 minutes. Okay, then you have to measure the blood pressure. And ideal position should be either the sitting with your arm having a support, or supine is also good enough. But most of the recommendation is to measure the blood pressure in the supine sitting position. And then you can use a digital BP apparatus. And again, you have to see that how it is being tied, and also there are some recommendations like you have to have some finger width, and the arm cuff should be appropriate for your arm circumference. So there are some this thing and all. So the ideal way to record is more important than the timing. Definitely there is a nocturnal variation for blood pressure. So Most of the time, we can take in the morning without any, when you are comfortable, that is good.
Sir, one participant is asking, doctor, which arm should I use to check up BP?
See, normally for an individual, suppose you are a right-handed individual, there can be a slightly higher, up to 10 millimeters of the difference can be there on the right hand compared to the left side. But it doesn't matter. See, if you are right-handed individual, you can take in the right hand, or you can take in the left hand also. Normally, does not vary more than 10 millimeters.
Okay, thank you, sir. So one more question is there. Sir, does stress and tension really increases blood pressure? How can I control it?
Definitely, stress will increase your stress-related hormones like the epinephrine, norepinephrine, and also they definitely bound to increase your blood pressure. To control, like we said, you have to practice some relaxation techniques. So practice some hobbies which will make you happy. Then we can use some meditation techniques, yoga, and even simple things like you walk for 10 minutes. It will reduce your stress and it will help you reduce your blood pressure.
Okay, sir.
And then sleep.
Sir,
Sleep is very important. Okay, you have to get at least 6 to 8 hours of proper sleep per day. That will improve your mental balance as well as reduce your blood pressure.
sir, one more question came, sir. Can I rely on digital BP reading at home?
Yeah. The current recommendation, see, none of the current guidelines recommend using a mercury-based apparatus. So we also in clinic hospitals also we use a digital apparatus only. So there are so many good companies are available. You can get good company online, or you can get from any nearby medical stores. You can, if it's properly calibrated, you can rely upon those machines. Only thing you have to calibrate. So once you buy the machine, you may have to consult your doctor just to see cross check whether it is the value what they are getting is corresponding to your machine. Up to some minor to 4 millimeters of difference is acceptable.
Okay, sir. So I think questions are almost over.
Okay.
So is there anyone? No, I think, sir. So thank you, doctor, for informative section, sir.
Thank you. Thank you for this opportunity.
Sir, thank you, doctor, for giving us this valuable guidance. I also thank all participants for joining us today webinar and making this section successful, sir. So stay healthy, stay active, and take care of your blood pressure. So thank you, everyone. Thank you, sir. Once again, thank you so much, sir.
Thank you. Thank you. Close comment. Yes.